morning. Nice to meet you. I am an intern.
Good morning. Please sit down.
Good morning, doctor. I have had very painful lesions inside my mouth for about 4 months. They break open easily and leave ulcers. Eating and even talking has become difficult. Sometimes the blood.
I understand. That must be very uncomfortable. Have you noticed similar lesions on your skin or anywhere else?
Yes, recently I noticed red shores under my arms and on my chest. They like round ones covered with crust. And I should mention that I have had a leg ulcer on my right leg for nearly 20 years, which never really helped.
Thank you for sharing that. Let's discuss your background a bit. Do you smoke or drink alcohol?
No, I have never smoked. I drink socially.
What about your work? Could you tell me more about your occupation?
I work in the car battery factory. I have been three for over 20 years. The doctors once told me I have chronic lead position because on the fumes.
That's important information. Occupational exposure to certain metals, including lead, has been associated with autoimmune disease. It may have contributed.
Doctor, may I ask how does lead exposure relate to Pemphigus vulgaris?
Of course, lead and other heavy metals can act as environment triggers, altering the autoimmune system. In genetically predisposed individuals, this can be led to the production of antibodies that attack skin and mucosal cells. It's not the only cause, but it can be a significant risk factor. Now, regarding your general health, have you had fever, fatigue, or any other symptoms?
Yes, I often feel very tired. I sometimes have headaches and mild shortness and breath. But the biggest problem is the pain in my mouth. Eating solid food is almost impossible. I have lost about 7 kilos in the last 2 months.
I see that weight loss is concerning, but understandable, given the pain when eating. On examination today, I can see ulcers on your lips, palate, cheeks, and the floor of your mouth, and even down to the larynx. You all
Doctor, what will be the next steps to confirm your suspicion?
we will perform a biopsy of one of the oral lesions. This allows us to study the tissue under the microscope. In Pemphigus vulgaris, we typically see blisters above the basal layer of the epithelium in a process called acanthalysis, which is the separation of the epithelial cells. We will also do a direct immunofluorescence test, which looks for antibodies deposited between the cells. In this disease, we expect to see IgG oranges in a fishnet pattern.
Doctor, should I have
No,
cancer?
this is not cancer. What you have is an autoimmune disease called Pemphigus vulgaris. It is not contagious and is not malignant, but it can be very serious if left untreated.
And what are the treatment options?
The cornerstone of treatment is systemic corticosteroids, usually prednisone, at high doses. Because long-term steroid use has many side effects, we combine with azathioprine. We combine it with azathiopyr, which helps control the disease and allows us to reduce the steroid dosage. Additionally, we give omeprazole to protect the stomach, calcium and vitamin D to protect the bones, and satin mouth rinses to prevent fungal infection.
Will I need to be hospitalized?
Yes, given the extent of your relation and your difficult eating, we will start treatment in the hospital. Once your condition is stabilized, you will continue treatment at home with close follow-up.
How long will I need treatment?
Pemphigus vulgaris is a chronic condition. Many patients need treatment for years, sometimes lifelong. However, with proper therapy, most achieve remission and live normal life. We will monitor your blood work, adjust your medication, and taper steroids as slowly as.
Doctor, what complications should we be most concerned about?
Excellent question. Without treatment, patients risk severe dehydration, malnutrition, and infections due to open skin and mucosal surface. With long-term corticosteroids, we must also monitor for osteoporosis, diabetes, and infection. That's why a careful balance required.
That sounds serious, but I am relieved to finally count what's happening.
Yes, but you've come at the right time. Early and aggressive treatment gives us a much better chance of controlling the disease. We'll work together in this. If you continue to persist with the symptoms, you should return for examination. Well, that's everything for today. Remember to take your medication, and I see you your next visit. It was my pleasure.